I thought it would be really cool for one of my Wellness Wednesday segments to take you all on a tour of one of my treatment rooms. I want to show you guys how I prepare, and then I can discuss some of the things that I treat and how I see people as a naprapathic doctor. So I will have more videos to come actually showing my treatments. And I'm also going to link a full-length video of myself receiving a treatment from a colleague when I injured my back. I injured like my lower back and right hip from working out basically. And so I'm gonna put that link to that full video in the description box below so you can check it out. But stay tuned for today's tour of Dr. Shante's treatment room. I'll see you in a bit. All right, so here is my patient. Of course, not a real person, but this would be how they would be on the table, face down first. As naprapathic doctors, we are connective tissue specialists. All right, you have connective tissue throughout your entire body. And amongst those tissues are also nerve tissue, bone tissue, muscle tissue. You guys get the point, right? And everything is connected together. And of course, the spinal cord and the brain is the central nervous system, and that's the computer of the body. Everything starts from there. And so what we do is we are trying to make sure that you are aligned straight. The little things that come out of here on the sides that we call nerves, and they go to innervate different parts of the body. So when I see a person, first thing that we're going to look at here, of course, are the hips. The pelvis is the seat of the spine, as you can see that here. And so we're palpating. It's a very personable medicine. So yes, we're palpating in these positions to see where it may be. Sometimes these bones do move and they shift. Why? Because we are moving and we shift. So we will go through and assess every single one. And we're just going through. We're checking for tension and we're checking for pain. So you're going to tell us that. We're going to be checking each one side to side. That's pretty much how we make our assessments. If something is moved, because we're looking at the spine three-dimensionally, if something is rotated or moved, and of course we're not treating in sections, we're treating each individual. Naprapathic technique allows us to be able to assess each individual one and treat each individual one, because every one of these vertebrae has its own blood supply and it has its own nerve supply. So this is my patient, and I would typically be treating them starting in this manner first, and then of course when the person flips over, and then there are some things that we'll be able to do as far as the front of the pelvis and then the back of the head. And so the patient that I have coming in today has neck pain, and of course the neck pain is radiating is radiating all the way down their left side, all the way to their hand. The patient is having pain radiating from their neck on the left side, and it's traveling all the way down their arm to their hands, where they are unable to grip anymore, right? And so now this pain is affecting voluntary movements, right? Think about grabbing your steering wheel, grabbing a cup of coffee. You're thinking to do it. So something's jumbled or scrambled in the signal that goes from here that says, I want to do this action, and then it gets down here and then there's nothing, right? And so this is me, this is the arm, this is, where everything is coming. And so the treatment for today for this patient is going to come from here, and I'm going to work all the way down, just seeing what's going on here, okay? So that we can get his voluntary movements back. We're not supposed to be in pain. And in fact, pain lets you know that something is wrong. Now, a lot of times we become conditioned to it, used to it. That's what I'm looking for, because the body compensates. So we get used to that pain and we learn to live with it until it gets to a point where it's like, oh my God, I cannot take it anymore. And simple movements become hard and take more energy to do. So when you feel that, that is when you know that you need to come see your naprapath. And so I'm looking forward to being able to help him. Of course, it's going to take a few treatments to get him back to full function where he will be able to make that fist again. That's me basically working with the connective tissues, the nerves, the muscles, and the bones to get him in alignment and get him back to wellness. There are so many great outcomes after you receive your naprapathic treatment, because we're going to increase your circulation, increase your range of motion, decrease pain, and that in and of itself is increasing your quality of life. Because, I mean, are you really yourself when you're in chronic pain and you've been that way a long time? No, we're going to help you get your life back. So I also want to say that if any of you are looking for this, maybe as a career path, I'm going to put the information in the description box below so you can come see me, come check us out. Now, back to increasing that blood flow, because there are two very important things that are carried in the blood, and that is nutrients and oxygen. So now we're going to help correct the tissues and get your tissues healing the way that they should, because we're going to feed them and we're going to give them some air. So that's it for today's video. I'll see you guys next week.